brain is being looked into by the sonographers. Best sonographers will be able to give us image on how this the monkeypox has it infiltrated with the brain or not. If it is not, it will show. If it is yes, it will show that the brain has been infiltrated with the monkey viral particles. So those are how we can diagnose the monkeypox. Sure.
All right, Mr. Josam. I think everyone now is having the picture of what mpox is. Now, how can mpox be treated? How can you treat someone who is diagnosed with mpox?
The treatment of mpox, as I said, that viral infections are difficult to treat, and most of the time in the medical area we don't believe that any viral infection has got a treatment, but we take advantage of, or we use theory of symptomatic treatment. When we say symptomatic treatment, it's more like that we take a clinical presentation of the patient, of the individual, and we treat them. Now, the treatment for monkeypox is number one is supportive care, whereby the patient must have enough rest. Rest shall imply that we want to prevent this condition must not migrate to the brain. Hydration. Since the individual, as I said already, has got a rash, can it be generalized rash, can it be localized rash, but the rash, when you have good rash, you become dehydrated. When you are dehydrated, you are having the chance of losing electrolytes, shall imply sodium chloride as well as potassium, which has got another implication, of which we see them as we go again down there when we are looking about the complication of this condition. So we need to have a very good hydration of this patient. So supportive care shall imply rest as well as hydration. Let's give the patient enough water so that he or she rehydrate herself, does not go into dehydration. Number two is antiviral medication. Antiviral medication, we just give it to this individual against those kind of orthoviral virus family class. Though for sure that we know that any viral medication, any viral infection has got no medication, but we just do it to suppress its viral load. That's why we give teconoviramat, that kind of antiviral medication. So that teconoviramat will control the multiplication of the orthoviral family of that causes monkeypox. So it is very important that we follow all the modalities that of treatment. Number three is vaccination. Vaccination of smallpox is 85% effectiveness. But now, why things has come to an issue with Malawi, even Central Africa like DRC, Congo, Burundi Basin, and the other Central African affected countries, because we stopped vaccinating this kind of condition. That's why it is now building up, and it has seen that according to sequencing of genetics makeup, it has changed its exhibitors. So it is very important that we try to liaise with all non-government organizations to find out the exact marker that we can use so that we can be prevented. We can have a very good vaccine against this monkeypox so that we prevent it, because vaccination, it shows that it has got its effectiveness or efficacy is about 85%. So those are the areas that, as far as treatment is concerned, just one drug against this, teconoviramat. That's what we use. But in Malawi, we don't have it. Yeah.
All right. So I think every disease that is caused by virus is dangerous. Now, what are the complications of this mpox disease?
Mpox can develop to different complications. Because as I said, when I was saying, I said that this mpox, of course, it attacks the integumental system, but it does not left so. It also goes with the respiratory system. So you find there will be respiratory failure. Wow, because those sore throats, it makes the pharynx, even other part of the respiratory system, not to function perfectly. As such, I expect that respiratory failure might have come because the larynx or the sore throat will result into inflammation of the larynx or even any other part of the respiratory system. Meningitis, it might be great to the brain and it attacks the meninges. When it attacks the meninges will inflame. Inflammation of the meninges, it shall imply that the meningitis recurs as a condition. Encephalitis as inflammation of the brain. If it goes to the brain become inflamed and it forms the condition what we call the encephalitis. Septicemia, condition whereby the presence of blood or bacteria in the blood system, because this one is, of course, it is being caused by the virus, but it is fighting against the immunity of the individual. I have seen that in clinical presentation whereby we have got inflamed lymph nodes. As such, nothing can be there in the blood than the presence of bacteria. That's septicemia. And the individual can die. Or at what rate? 1 to 10%. That shall entail 10 out of 100 individuals who have this mpox, they can die. Those are the complications of mpox. That's what I can say about the complication of mpox.
All right, as we are winding up today's program, let's now go to prevention. How can someone prevent mpox?
Prevention is better than a cure. Every viral infection, for you to control it, you need to prevent it. Because the viral infection has got no any drug that can stand up to cure it. Even HIV will give you ARVs for nothing but to control the viral load. Same like this one. Number one thing is to avoid contact with infected animal or people. We said already there on overview that this can be transmission can be animal to animal, like rodents. Then avoiding contact with rodents. Rodents, they are the harbors of this orthoviral virus family which causes mpox. As such, you need to prevent contact of those kind of things. You have again to prevent the contact of people. People might have some clinical presentation like this rashes, flat one, red blisters one. So those kind of people, prevent them. Avoid shaking hands. All the hygiene mechanical things, make sure that you put them in line. That's number one, prevention. Number two, prevention. Wear protective gears. That is much more emphasized to the health workers. They have to put on mask as well as the gloves. Gloves, how? This patient have said that this patient might have some blisters. If you touch the patient with bare hands, the chances for you to get the infection is high. Even though you have got no cut. But where the titer is high, penetration can take place. Remember that our body has got some permeable membranes. So those membranes can allow this kind of things to get in because of its quantity. So that quantification must again be matters. So masking, they're trying to say to us is that if the patient has got monkeypox, sometimes coughs, and it behaves like a person who has got COVID-19, in such doing, we need to know how to handle this kind of patient. That droplets must not come in contact with you, because if it comes in contact with you, you expect that you can inhale those kind of droplets, and that droplets will go into your larynx, forming sore throat, forming inflammation of the larynx. As such, there will be a condition will arise in you. So that is the way we can avoid those kind of things. Number 3 is practice good hygiene. Hygiene is a soul with the cleanliness. It's a soul that you can prevent. Even in a biblical term, we always advise people must be clean. How people must be clean? In Muslim, they believe that when you have gone to the toilet, they wash the toilet using their hands, and they completely become clean guys when they have used those kind of methods. So it is very important that we make sure that our hygiene is intact enough so that we can prevent all those kind of things. Number 4 thing is for vaccination. Vaccination is only provided to people who have got high risk. High risk individual is individuals who are staying in the belt whereby we have got mpox. In this case, we are talking of Congo Basin, Burundi, Central Africa. All those individuals, the key markers that we need to give them vaccine. But the vaccine that is being produced now is not efficacious enough, because we depend much on the fund from the white guys to give us vaccine, because Africans, they are beggars, and we fail even to produce our own vaccine. As such, as of now, we don't have vaccine specifically for mpox, because we are waiting for the wise guys to do the researches. If they do research enough, they will be able to, I hope and believe they will be able to come up with the ideologies which is the best vaccine that can help in terms of mpox eradication in as far as epidemiological issues is concerned. So those are the part and parcel that I can say about the prevention measures about mpox issue.
All right, let me thank you once again, Mr. Gift Joseph, for joining us in today's program, whereby we were discussing mpox. This marks the end of our program. You were with me, Divine Simchoka, the producer and the editor of the program, and my guest was Mr. Gift Joseph from Mulanje District Hospital. Let's meet again in the next episode, whereby we'll come again with another medical condition. Till we meet again in the next program.